So we're going to talk about the ever dreaded anterior pelvic tilt, the butt wink, or just rotating the hips forward rather than pushing the hips back when you go into the squat, keeping the pelvis in line and under you. I've seen this video a million times, and I've seen it described a million ways. I've done it a couple of different ways, and I guess I'm going to try and do it one more way because it's still really hard to understand for a lot of people. So as of right now, I have a client that is having an issue with wanting to squat into this position. He's trying to keep his chest as tall as possible, and it's putting him into this position here. Okay, now he's more flexible than I am, and he's actually able to hit depth in that position. However, his hips are way back behind him here, compressing the lower spine, the lumbar. As he descends, his hip flexors are getting extremely tight, and his knees are moving extremely far forward. And I'm not here to argue about knee movement forwards and backwards. It's not necessarily an issue, but it's causing excessive movement because he has no hip movement, okay? So, a little trick. If you're filming yourself from the front, okay, so right now, it's probably not the best colors, actually, now that I'm thinking about it. However, I'm braced right now. I've got a little brace, stomach's full of some air, obviously talking, and my glutes are squeezed and I'm rooted into the floor. And now, watch basically from my torso, my logo on my shirt, to the face of my belt. Okay, do you see how as I push back and sit down, everything moved in line from the side? So, pinning my ribs, belly, squeeze the glute, root the floor, push back. Okay, do you see that? Everything from my head to basically my tailbone is moving as one unit, okay? So what we're getting into here is this, okay? And now the thing is here, you don't want to be in this position. We want to be here, strong, okay? So see it from the front. Boom, one unit, okay? Now I'm going to just move at the hips. Do you see how my belt moved, angled towards the floor, but my torso, the logo on my shirt did not? So from the side, boom. Okay, versus, okay, does that make sense? So once again, from the front, what you're looking for when you look at your video is if at any time you go into the squat and let's say you're here and then it breaks loose and you saw the belt flop towards the ground, or anytime that you come up and you see it come back under real hard, but your torso is not going with it, you know you've got an issue in your bracing. All right, everything needs to be in line. Keep the chest down, pin your lats down. You don't ever want to flare through the rib cage or through the back, and you especially don't want to do what a lot of people do and do both, and then squat along these lines. See, that's just, it's not very strong or pretty looking, and that's about as low as I can go. But pull under, pin the ribs, move in one unit. I hope that helps.